So next speaker is Brandon Erickson. He's going to speak about the biomechanics of the core in throwers. Brandon.
I can speak pretty loudly and say, oh, no, now it's back on. Very good. Now it's back on. Sorry, didn't mean to scream at you. So first of all, thank you very much, Dr. Guy, for hosting this meeting. Thank you for including me. I'm honored to be here. It's great to see so many faces here. So Dr. Tanaka just gave you a great synopsis of the shoulder and elbow. I'm going to take it down a little bit. We're going to start talking about the core, okay? Now, disclosures for this are irrelevant. If you look in the literature, there's a lot of definitions of what the core is, okay? And it's very hard for us to define in baseball what we consider to be the core. You don't have to worry about what this slide says. Just know that if you look up what the core is in the literature, there are a whole lot of definitions. But I think for the purposes of today, we're going to define the core as a few different sets of muscles here. We're going to look at the rectus abdominis, your hip adductors, abductors, your extensors, so your gluteus maximus, gluteus medius, gluteus minimus, things of that nature. Your hip flexors, so your iliopsoas, then things in the back, your erector spinae, your oblique muscles side to side. And then people talk about sometimes the quadriceps and the hamstrings because they cross, the quad crosses the hip joint. Whether or not we should include this as being a core muscle. For the purposes of this talk, I think we'll just exclude that from being a core muscle. If you look at this throw here by Chapman, it takes a lot to throw a ball at 105 miles an hour. And so like we talked about before about the shoulder and elbow, it's very important. But you have to build that strength. You have to build that force from the ground up. And so if you look at how he strides, his stride length is 120% of his height, much more than most pitchers. So his core, his lower extremities are working very hard. When his front foot hits the ground, his hip to shoulder separation is significantly higher than most pitchers. Meaning when his front foot hits the ground, his hips are facing home plate and his shoulder is facing third base, whereas some pitchers tend to sneak in a little bit where their torso tends to face the kind of the third baseline in a right-handed pitcher. And then obviously the acceleration phase, but that's not really to do with the core for this purposes of this. So as I kind of said, core musculature generating a forceful pitch, really very important. And so the other thing the core does actually is it prevents injury further upstream. So if we look at a couple of papers that have come out recently, when we start to have deficits in our core, whether it be core weakness or loss of motion, we start to see other injuries that creep up. So if you look at this paper that was put out just recently, you can see that internal rotation deficits of the hip actually were predictive of back and abdominal injuries. Not so much for elbow injuries, but if you look further on at this paper that was put out last year, you can see that as hip motion went down, hip injuries went up. Actually, this correlated to further upper extremity injuries, shoulder and elbow injuries down the road. And finally, if you look at kind of days on the disabled list, or excuse me, the injured list for pitchers that had core injuries, about 14% of all injuries that pitchers sustained were related to the core. A lot of them were more hip and groin. And it kept them out for an average of 47 days for the core, and kind of groin injuries was about 38 days. And so I think now that we kind of have an idea of what we're talking about for the core, I think we need to talk a little bit about the biomechanics of the core. We kind of saw the different pitching cycle phases, and we'll go through that a little bit here again. But just to remind you, and we're going to say this a lot today, to generate a forceful pitch, it's more than just the shoulder and the elbow. It's more than just the lower extremities. Everything has to be working in concert, working together harmoniously for you to create a very forceful pitch, because the amount of velocity your shoulder and elbow have to create can't just be done without the help of the lower extremity musculature and your core muscles working together. The reason I brought up hip to shoulder separation before, and I think it's very important for the core, is that when we look at pitchers as they start to go through the course of the game, this was a study we did fatiguing adolescent pitchers, you can see that as they kind of went on with their pitch numbers as they got further along in the game, their fatigue went up, their pain went up, and their hip to shoulder separation started to decline. And this is, in my opinion, a function of core weakness. And we know from Dr. Fleisig's work and some of the work from some other people in this room that as pitchers start to throw when they're fatigued, they're at a higher risk of injury. Why is that? Well, maybe it's because the core is not working properly and they're starting to use other things improperly. They're externally rotating their shoulder more than they need to before. They're putting more stress through their shoulder and elbow because they're not properly rotating through the core because it's becoming weak. Now, one of the things we have a hard time doing is defining how to measure core strength and core fatigue. One way that I think is reasonable is this hip to shoulder separation, but we don't have a good test right now that measures how strong somebody's core is or what the endurance of someone's core is. It's something we have to work on in baseball. So we kind of talked about the phases of the pitching cycle, and I'll just bring up here from a core muscle standpoint. When you go to the windup phase, as you know, initial movement to the max knee height, you're looking at hip flexors on the lead leg. You're looking at core activation to balance your torso over that trail leg or the stance leg here, okay? As we progress along to the early cocking phase, where it's that max knee height to the point of front foot contact, and this is where the shoulder goes into that semi-cock position that we just heard Dr. Tanaka talk about. You can see the abdominal muscles have to maintain your trunk upright. Your obliques have to begin to rotate the trunk away from the pelvis, and this is how you begin to maintain that hip to shoulder separation. The stronger your core is, the more mobile your core is, the better you can maintain this hip to shoulder separation. The less stress you put on the shoulder and elbow, the faster you can wind up throwing and decreasing your risk of injury. It also activates your hip abductors in your lead leg as well as your trail leg. And you have your hip extensors and abductors as well as your knee flexors starting to build the energy. If you think of the kinetic chain in the core almost like a spring that you're starting to tighten before it kind of pops when you get to the acceleration phase. We move along. This is kind of a picture here. I didn't know we were going to have videos in the last one, so this is just to show you, but we've kind of already seen this, so we'll pass it. Late cocking phase, very short phase, a lot of stress on the shoulder elbow. From a core muscle perspective, you still have the gluteus medius, gluteus maximus working in both your stride leg and your stance leg, so your front leg and your back leg. You have your trunk beginning to rotate towards home plate, so this is where that hip to shoulder separation comes in, and you start to bring the force from your legs up through your core before you start to impart it on your shoulder. Your erector spinae, again, maintaining your trunk upright, and your iliopsoas has some flexion in your lead leg as you start to bend down, eccentrically contracting here. This is just the late cocking phase. As we move on to the acceleration phase, we know this is the most explosive phase, and we know this is when a lot of the injuries happen in baseball. Obviously, we heard about the shoulder things. When we talk about the core, there's not a whole lot for the core in this very short period of time. It's more isometric contractions that you have going on in the core here. But there is activation, again, from the gluteus medius, gluteus maximus, from your stride leg and your stance legs. But this phase is very quick, and so by now you've started to pass that force through the core and now up to the shoulder and elbow. So you're starting to dissipate the force from the core here. The deceleration phase, like we heard about, is a very violent phase because you have to essentially stop the arm from coming off the body. And from a core muscle perspective, you really have to think about your stride and stance legs. You're starting to bring your trail leg back over the top to get into that fielding position, which is going to come in the follow-through phase. You have to allow your abdominals to contract to allow for trunk flexion here, because as you can see when the pitchers are going through deceleration in the video here, they start to bend forward and they start to lift that leg up over the back. So that's that max internal rotation that their shoulder gets to. So you can see their trail leg is starting to come up, and it's going to come over the top as they come to the follow-through phase. So that core has to have a good amount of hip motion there. If you think about the hip motion in your front leg when you're starting to rotate, you can think about it, the more motion you have in that front hip, the less stress you have to put on your abdominals, the less stress you have to put on your shoulder, because you can rotate through that hip a little more. As you start to lose some motion in that front hip, and even in the back hip when you start to bring it over the top here, it can lead to further injuries kind of upstream or higher up in the shoulder and elbow. And lastly is the follow-through phase, again, where your leg's coming up and over the top and you're getting into that fielding position. Again, the hips have to rotate here. Your core, again, has to maintain stability over your front leg. You think about a single leg stance, it actually takes a lot of core activation to keep you in a standing position on just one leg. So the stronger your core is, the better you can maintain your body position here. So we think about this kind of in conclusion. The baseball pitch is very much a kinetic chain exercise, so the core is very important, the shoulder and elbow are very important, but really if you want to generate a very forceful pitch, it really starts with the core. As you get that hip to shoulder separation, as you continue to generate force that comes up from the ground, you can really stress the shoulder and elbow much less while still generating a very forceful pitch. So in my opinion, if we can figure out how to better measure what the core is, measure core strength, figure out how to strengthen the core from a baseball perspective, we can probably decrease the amount of shoulder and injuries significantly. Thank you.
Thank you. Great talk.